Welcome to Hit Show, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. It's Wednesday, October 15th. Today, coming up on Hit Show, the Joint Commission calls it a defining moment for nursing. We'll look at how workforce adequacy is becoming a formal measure of quality. Also, hospitals doubling down on empathy and patient experience, Oracle reshaping Nashville's skyline, and Carrum Health's fast-growing value-based model. Plus, Pear Suite's big funding round and how it's powering community health workers nationwide. Let's get started. We start today with a story that could fundamentally reshape how hospitals think about quality. For decades, staffing was treated as an operational issue, not a safety one. That's about to change. Nate Collier joins us with more.
The Joint Commission is officially moving to tie hospital accreditation to nurse staffing standards beginning in 2026, a move the organization is calling a defining moment for nursing. Hospitals will now have to demonstrate that they maintain adequate staffing ratios as part of their quality reporting, and it's expected to influence not just compliance but reimbursement and public trust. The new framework will require boards to elevate nurse leaders into enterprise-level governance, publish transparent staffing metrics, and show how staffing directly affects patient outcomes.
So, Nate, how do you see hospitals responding?
Many are looking at AI-assisted scheduling and workforce analytics to optimize coverage while easing burnout. Others are expanding float pools and retention bonuses. It's a recognition that safe staffing isn't just a budget line, it's a quality metric.
Exactly. When safety depends on staffing, transparency becomes part of the cure. And speaking of quality, new research shows patients are voting with their hearts. Jabe Romero has the details.
Rhonda, NRC Health's 2025 Patient Experience and Consumer Loyalty Awards analyzed feedback from more than 310,000 consumers. The clear takeaway: emotional connection and personalized communication drive loyalty far more than convenience or digital tools. Top hospitals are combining human empathy with bedside tech, like real-time rounding apps that trigger instant service recovery alerts. It's proof that the future of experience isn't more automation, it's better listening.
That's a powerful insight. Technology amplifying empathy, not replacing it. Next, a quick look at a tech giant betting big on healthcare's next corridor. Logan Stokes reports.
Oracle has unveiled renderings for its $1.2 billion East Bank campus in Nashville. The massive development features 2 office towers, a riverfront park, and a pedestrian bridge, part of Oracle's plan to make Nashville its long-term headquarters and an AI innovation hub. The project is projected to create more than 8,500 jobs by 2031. Cementing the city's status as a southern powerhouse for tech and healthcare analytics.
It's not just a campus, it's a skyline statement. Coming up after the break, a fresh wave of innovation in community care. We'll tell you how Pear Suite is helping grassroots health workers get paid for the work they've always done and what it means for the future of public health.
Hit Show is made possible by EY, a globally connected, multidisciplinary professional services organization driven by innovation and action for the long term. An optimistic future where business, people, society, and the planet thrive. EY can help you shape the future with confidence.
You're listening to Hit Show. Welcome back. Turning now to innovation on the front lines of care. Here's Anika Shah.
Pear Suite has raised $7.6 million in series of funding to expand its AI-powered platform for community health workers. The software lets community-based organizations document care plans, assess social needs, and even submit claims to Medicaid and Medicare plans. For years, these organizations provided care without reimbursement. Now, with credentialing and tools like Pear Suite, they're becoming recognized providers in the healthcare ecosystem.
That's a huge step toward equity, and it's the perfect setup for today's bright spot. But first, one more market trend worth watching. Teresa Vaughn brings us a story about one company that's having a major impact for employer health coverage.
Carrum Health has doubled its covered lives to 6.7 million, adding 3.6 million this year as employers face record healthcare costs. The company's Centers of Excellence model bundles high-cost surgeries and specialty care into fixed, outcome-based payments, cutting waste and improving predictability. Employers love the transparency. Hospitals, meanwhile, are rethinking their referral networks and pricing strategies to stay competitive. It's another sign that value-based specialty care is moving from experiment to expectation.
And it sets the stage perfectly for the story of a startup championing landscape change for community health workers. Jalen brings us today's bright spot.
Today's bright spot is focused on Pear Suite, a company scaling trust-based care from the ground up. CEO Colby Takeda joins us now. Hey, Colby, thanks for being on the program and congrats on the recent fundraise. What is Pear Suite's mission?
So at Pear Suite, we're all about community health workers, empowering them, using their lived experience, identifying those who have the skills and community connections to make a difference in the healthcare system, but for decades haven't been able to partner with health plans and providers.
So what does the Pear Suite AI-powered platform help those workers do?
That allows them to document their care plans, create assessments, understand the needs and interests of those they're serving, their clients and patients, and then provide them the resources and skills and tools to be healthy and happy and more independent.
And get paid for their work?
We also allow these organizations, lots of times they're community-based, they're nonprofits, they're small groups working in housing sites, they're on the streets doing street medicine to submit claims and get paid.
So that's the engine behind Pear Suite's fast-growing Pear Cares provider network?
The power of our Pear Suite provider network now, which has over 1,000 community health workers across the country, is that we can partner with health systems that need extra capacity with community health workers. We can help health plans close HEDIS gaps and STARS gaps in different languages and different locations.
Thank you, Colby. Really appreciate you joining the show today, and congrats again on the Series A. Pear Suite just raised $7.6 million in accelerating a movement to value and to compensate community health workers like never before.
Thank you, Jalen. That's all the time we have for today. Thank you for joining us on Hit Show. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on hit.show. Hit Show, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. Hit Show is made possible by EY, a globally connected, multidisciplinary professional services organization driven by innovation and action for the long term. An optimistic future where business, people, society, and the planet thrive. EY can help you shape the future with confidence.